Welcome, everyone. We are exactly at 12 o'clock Eastern Time, but we're going to give folks 30 seconds to continue joining us. I see that we have 20 people came in those last 2 seconds where I was just speaking. So I'm Ashani Johnson-Turbis, and I am now the past president of the Society for Health Communication, and we will wait a few moments to allow our peers to keep joining. All right, everyone. It is 12:02 almost. It's going to turn to 12:02. It is 12:02 on my clock. Welcome, everyone, to the Society for Health Communication February webinar on how storytelling drives behavior change in health communication. We are going ahead and we are starting, so we can go ahead to the next slide. So we're really honored to be able to have Kelly McDonald here, founder and senior brand strategist at Brave Tail, for our first webinar of 2026. She is inaugural webinar 2026 kicking off. And as I stated just moments ago, this is part of our Level Up Learning series, webinar series. And the title, as you see here on the screen, How Storytelling Drives Behavior Change in Health Communication. Consistently last year, we would hear from many of our colleagues and many of our members and leaders in the society about how important storytelling is. And so we decided to kick off our Level Up Learning series with a webinar on storytelling. We can go ahead to the next slide. So let me start by just saying a little bit about the Society for Health Communication, and also I get the honor of saying a little bit about the Society, also talking about our new president and vice president. The Society was founded in 2016, as you see here on the screen, to unify our field across industries, really behind one singular vision. It is very much to recognize that this is an interdisciplinary, multidisciplinary, and hopefully as we continue, transdisciplinary field, which is health communication. We were founded by Jay Bernhardt, in 2016. You see our mission stated there. I will not read it out loud because I know all of you can. We have over 6,500 individual members. Actually, I think we might be up to 7,000. My colleagues will always correct me on that, and over 30 organizational members, and they move across multiple sectors, disciplines, academia, industry, multiple different disciplines. So we're really honored that we have wonderful representation in that regard. You see here on the screen the 2026 executive leadership team. I have had the honor over the past 2 years to be the president of the society, but I get to hand the baton to Erin Norville, who will now serve our board of directors, voted her in as president of the society. LaShondra Cordier will serve as the vice president. Stephanie Mize will continue in her role, wonderful role, as member at large. I get to move into a position of being past president. You all, if you've been on any webinars before, you know Dana Chimenko is our executive director, and Diane Brodowski is our communications director. And it is this amazing and wonderful team of health communication professionals that lead the society. We can go ahead to the next slide. A little bit of webinar housekeeping before we get started. All of you will be automatically muted. We are recording the sessions, which started immediately when I started speaking, and the recording will be available on the Society website and the slides in the coming weeks, and you can go and see past webinars there as well. The chat function is open for discussion. I see lots of people moving around in the chat, introducing yourselves right now. Please use the chat. It's actually one of the most fun parts of webinar, is seeing people's interaction with each other and with speakers in the chat. Submit all your speaker questions through the Q&A function. I think you can also use it in the chat, but again, my colleagues will keep me honest and correct me if I'm wrong. But yes, through the Q&A function, or if you want to just pop it into the chat, that's okay as well. Send a chat message to the host if you're having any technical issues. And of course, you can press the CC button in the bottom left corner. For some people, it's sometimes on the right corner, but often on the bottom left corner if you want to turn on closed captioning. Next slide, please. So I get to welcome our speaker. I'm going to read you a little bio about her, but I might ad-lib a little bit in this because I had the honor of meeting Kelly virtually several months ago. And so I'm going to tell you a little bit about that. But first, I'll say she is a senior brand strategist and copywriter and founder of Brave Tail, a brand strategy and design studio that serves emerging tech and health innovators. She launched Brave Tail to combine her passion for storytelling with her entrepreneurial drive, helping organizations clarify their value and communicate with impact. She has more than a decade of experience. Her work, Kelly specializes in go-to market positioning, messaging, architecture, thought leadership, and campaign content. And her work is firmly and beautifully grounded in the belief that a strong brand voice and clear messaging drive engagement, influence perception, and support long-term growth. When I first talked, when Kelly called me up months ago and it's like, hey, I'd like to talk with you because she had attended the Society Summit, I think virtually, if I'm correct, Kelly, you can nod, and said, let's connect. So we connected over like just a one-on-one meeting to have coffee. And I was immediately taken with her and how she expressed herself and how she talked about her work, and that she was a history professor and she put the whole context of the work she put the work that we are doing as health communication and public health scientists in the context of a historical story, and she had that very professorial spirit, and I just thought this is a woman that we want to have working with us, conducting a webinar, engaged with our members. So she thankfully responded when I said, reached out and said, hey, Kelly, would you be interested in doing a webinar? So we're really honored to have Kelly McDonald with us today. With that, I'm going to give her the stage and I will disappear. Kelly.
Wonderful. Thank you so much. I'm quite humbled by that introduction. So thank you very much, Ashani. And thank you to everybody who is here. I have been really looking forward to doing this webinar and to connect with health communicators like you. As Ashani said, I come to the world of health communication from two worlds, one through marketing and brand, and through working with mostly private industry, science founders, doctor founders, in terms of helping them craft a story for their business that's going to connect to the people they aim to serve. But the other element of my background is in medical history, and I'm going to talk about that a little bit later. But one of the things that I love working with health innovators, whether it be in private industry or in public health, like a lot of people here, or in academia, is that you are all very driven people who are trying to make the world a better place through health. And I really like working with people who have a genuine and earnest drive to make the world better through the work that they do. And I know that for people working in public health, especially, that's a hard road to hoe. So my goal for today is to explore storytelling through the lens of health, and to give you some tactics, some tools, maybe a different point of view on how storytelling can help you achieve those goals within your organization or business. Yeah, and a little bit more background about me. I do run this brand agency where I help a lot of health tech founders tell their story. I have a lot of experience working in marketing and brand. But as a college teacher, I am also very familiar with trying to communicate an idea to a not so receptive audience. So while it's a skill set I honed that I think a lot of health communicators might also have to utilize. And my background is very interdisciplinary. I have a master's degree in the history of medicine. It's my favorite subject. It's my favorite topic. And one of the things that I love so much about the history of medicine is that when you look at how people conceptualize and treat the physical body, it illuminates so much about the larger social body, the values, ideas, and cultural beliefs of the body politic. We impose that onto the human body. So as I studied the history of medicine, I learned so much about different cultures and different times and places. And the one consistent thing that I learned, especially when it comes to scientific innovation, changes in human behavior as it relates to health, is that while facts are going to be on your side, facts alone are not enough to inspire people to behave in healthier ways. That story shows up time and time again when you look at the history of medicine. And many of you probably understand this in your own work, but I think a perfect example of how facts don't change behavior is if we look at smoking. Um, I grew up in a time when it was pretty well known that smoking is bad for your health. And yet, many of my friends smoked cigarettes in high school. And it wasn't, they were not deterred by the facts of the health problems that smoking causes. And the fact is that the behavior of smoking, the idea of smoking, has a totally different story that is much more intoxicating than the story that it can cause disease. So if you think about James Dean or Marlon Brando or the characters in a Quentin Tarantino movie, like smoking is cool, smoking is a little bit subversive. So if you were a kid in my high school that wanted to position yourself a little bit as of an outsider, maybe be a bit edgy, and find a community, smoking was a good avenue to do that. And the health facts were outweighed by the story that smoking created for those people. And this sort of ties in to an overall concept that I really hold on to when I think about storytelling. So this is a picture of Margaret Atwood. She wrote Handmaid's Tale and 18 other fantastic books. She's a fellow Canadian, and she talks a lot about storytelling. And she says, you know, storytelling is not a luxury to humanity. It's almost as necessary as bread. We cannot imagine ourselves without it because the self is a story. So it's a little bit meta if you really think about it, but like we don't only listen to stories when we do behaviors, our behaviors are also informed by the stories we tell about ourselves. And we understand the world through stories. We are actually hardwired to learn things through stories. So you are all health communicators. You do like facts. So I will indulge you and give you some facts on top of a story. And there's been some research to look at the power of storytelling. And one researcher at Princeton looked at how the brain works when somebody is given just a list of facts and somebody is told those facts couched in a story. And what he realized was that facts alone will activate language centers in the brain. But if you couch your facts within a story, then your sensory, motor, and emotional centers of your brain light up. You are 22 times more likely to remember facts when it's told within a story. And I think we instinctively understand that because when we teach children lessons, we often do it in parables or fairy tales. Many cultures have their origin stories, and we like to learn through story. And I think this is an incredibly important idea, especially when we're trying to motivate people to do things to their own health benefits. And to illustrate the power of storytelling, instead of inundating you with more facts, I thought that today would be a good opportunity to tell you one of my favorite stories in medical history. It's the tale of two doctors, both of whom discovered the exact same thing. They had the same science, but the outcomes of their discovery were very, very different and connected to storytelling. And I'm going to don my teacher hat a little bit here. So as I'm telling the story, I would really appreciate if you guys paid attention to two things. I'd like you to ask yourself, okay, well, what does this tale of two doctors tell me about the elements of a good story? And what does the tale of two doctors tell me about the nature of a good storyteller? So that's your assignment for the next 10 minutes. As you're listening to the story, ask yourself, well, what makes for a good story? What makes for a good storyteller? And I will begin. So our story begins in the 1840s in Vienna. There is a doctor by the name of Ignace Semmelweis. He is Hungarian, but he's living under the Austro-Hungarian Empire, and he's working in a hospital in Vienna. And this particular hospital in Vienna was where a lot of women delivered their babies. But there were two wards in the hospital. One ward was run by the doctors and the med students of the time, and the other ward for deliveries was run by midwives. And Semmelweis was obviously a doctor, and he was working in the doctor side of the delivery department. And he was in the waiting room one day, and he came upon a woman who was about to deliver her baby, and she was in absolute hysterics because she had been told that she was going to have to deliver her baby on the doctor side of the hospital. And she begged and begged and begged Dr. Semmelweis to put her in to the midwife side. And she explained to him that it was common knowledge amongst the women in this part of Vienna that if you were delivering your baby on the doctor's side, you were going to die. So Semmelweis was quite shocked by this realization that women in the neighborhood were afraid of delivering in the doctor's side of the hospital. And he investigated to find out if there was any validity to this fear. And in fact, he found quite a bit of validity. He noted that the mortality rate amongst mothers, so death by childbed fever, was 3% in the midwife side of the hospital. But on the doctor side of the hospital, it was 18%. So it's quite a significant difference. And being the good scientist that he was, he investigated the differences between these two wards. Now, at the time, it was believed that disease was caused by miasma. I think a lot of people here probably know what that means, but just to clarify, it was the belief that disease is caused by bad air. And this is an ancient story. It goes all the way back to antiquity, that bad air, bad smells are what cause illness. And this was a story that had been told for millennia, and doctors still embraced it. But when Semmelweis looked at the differences between the midwife side and the doctor's side, aeration was the same, and quite frankly, a lot of the delivery practice was the same. There was only one striking difference, and that was that on the doctor's side, on the med school side, doctors were conducting autopsies and doing anatomy lectures and then going off to deliver babies. I'm sorry, it's lunchtime and that's gross, but yes, doctors were putting their hands in dead bodies and then proceeding to deliver babies. And so Semmelweis concluded that there must be some transference of something that was causing these fevers in the doctor's side of the hospital. So he implemented a policy that everybody should be washing their hands thoroughly, crazy idea, before they delivered the babies. And what he found, not surprising to anybody on this call, was that as a result, the rates of infection, the rates of death by childbed fever dropped significantly. Within 1 month of him making the order, it dropped down to below 5%. And when the process started to get better, by December, it was at 0%. This is wonderful news. And if we look at the facts of the situation, you would imagine that this chart alone would be enough for people to change their behavior. And washing your hands isn't really that much of an ask. And yet, Semmelweis's discovery landed flat. Nobody bought in. And I think that the case of Ignace Semmelweis is one of those cases where you have a person who is completely right in the absolutely wrong way. And I feel very bad for Semmelweis, but I can also kind of relate to him. I don't know if you've ever gotten into some kind of an argument with someone where you are definitely in the right, but your delivery is completely wrong, and somehow you end up being the jerk in the situation. I think if you've ever had those situations, if you ever find yourself in those situations, just remember that Semmelweis probably did it worst, the worst in history, because what he did was an example of really terrible storytelling. So the first thing is that even though he discovered this phenomenon, or this great discovery that washing your hands can save women's lives, he didn't publish his ideas until 13 years later. So he automatically creates a kind of suspicion in the validity of his claims. The second thing is that when he published, he did it in the most opaque and complex language. Like his writing was really hard to understand. Um, when you could have used a 3-letter word, he chose a 10-letter word. Like he was just overly complicated in how he was expressing his ideas. And even though his audience were men of letters, like they're busy. They don't need to try to decipher your opaque language. The other thing is that a lot of people were very resistant to what Semmelweis was saying. What he was saying was very revolutionary and countered the common wisdom of the time about miasma. And when Semmelweis received pushback, instead of being diplomatic, he inundated journals with very angry letters. He called out doctors for being idiots. And as a result, some of the people who were more open and receptive to what Semmelweis said early on kind of distanced themselves later because of how aggressive Semmelweis was. He really saw his audience in many ways as the perpetrators of what he said, like murdering women. And he used shame and aggression to try to convince people that he was right and they were wrong. The end result is that Semmelweis was put into a mental institute by his colleagues, and he was beaten by his guards, and he eventually died in this mental institute of sepsis. So it was an incredibly tragic story. Tragic for Semmelweis as an individual, but also tragic for the countless women who would have been saved if Semmelweis had learned how to tell a better story. We do have some good news. About 30 years later, Joseph Lister, a surgeon in Britain, came up with a similar idea, but his experience and his storytelling were completely different. So Joseph Lister, again, a very well-connected surgeon in England, noticed that when he was conducting operations, primarily on compound fractures, he could have a very successful operation. He could solve the acute issue at hand. But a few days later, his patients would also often succumb to a fever. And this was really, really frustrating for Joseph Lister. But he was vaguely familiar with Semmelweis at the time. He was hearing a little bit about germ theory, and he thought maybe it has to do with cleanliness in the surgery. And again, it's lunchtime, so I don't want to get into too many graphic details about what 19th century surgery was like. If you like gore, research it. But if you can think of like just like a butcher's room, like the surgical rooms in the 19th century were pretty vile. And Lister changed this. What he did was he introduced the utilization of carbolic acid in the surgical operation. And I actually think that this is quite interesting too. You'll see that he kind of used a tool that was like gaseous. It almost played into this idea of miasma, right? Like he's cleaning the air, but he also cleaned the surgery. You can see cloths. And once he had a more hygienic and clean surgery, mortality rates amongst his patients dropped by about 15%. By 30%, down to 15. So Lister was incredibly excited about this. And I would say that the victory wasn't just the finding, the victory was also in how he demonstrated great storytelling. Lister is a case of understanding your audience and understanding what they want. So the first thing that Lister did in terms of his storytelling was that he published his findings in this timely manner. So he wasn't waiting until it was absolutely perfect. He ran an experiment in the surgery, he got an outcome, and he immediately published it. And by doing this, he published in this timely manner in the Lancet. He actually brought his audience along in that discovery process. So if you can think of Dickens at the time writing in a serial way, Lister kind of did that too. He also wrote in a very clear and simple way. So he was saving his audience time in terms of understanding. And he connected his ideas to what was also going on in the medical community at the time. So he was connecting his findings to that of Pasteur and Koch and people on the continent who were studying germ theory or developing germ theory. He also like shared his experience. He didn't just write, he demonstrated, he lectured at schools, he gave presentations. He took the story and he used different mediums by which to communicate those ideas. He played a lot of show and tell, which is a great way to bring his audience into the experience of this discovery. And the other thing that I think is really important to highlight is that even though Lister was a super connected, very respected surgeon in England, Great Britain and England, they completely laughed at what he was doing. They thought his work was ridiculous. They were just as dismissive of him as the doctors in Vienna were dismissive of Semmelweis. But Lister's uh, response to that was very different. He just pivoted and he decided to start sharing more of his findings in continental Europe, where, pardon the pun, the germ of germ theory was festering and growing. So like they were starting to connect what Koch and Pasteur were doing with the practical application of what Lister was doing. And I think the other really important thing was that at no point, even if the doctors were laughing at him, he never positioned them as the enemy. What he positioned was the fever as the enemy, the infection that caused the fever as the enemy. He says infection is the enemy of progress in medicine, and he presents a solution for everybody. Cleanliness is our only defense. So by being one of the people, being part of his audience, he is able to tell this story in a very empathetic way. And so if we compare Lister and Semmelweis, you have essentially the exact same discovery, the exact same understanding of the cause of disease, but Lister ends up being the father of antiseptics, and Semmelweis ends up being sort of relegated to the pages of history. And we can look at how they told the story. Semmelweis called his colleagues murderers. Lister said, you know, we share this heartbreak together. Nobody wants to see a patient die. Semmelweis sent accusatory letters calling out physicians that he didn't like. Lister published his findings step by step, patiently, and brought people into the experience with them. They discovered alongside him. Semmelweis waited to be perfect to publish. Lister demonstrated his work publicly. He tried different tactics in terms of telling his story. Semmelweis antagonized people, even his own supervisor, who could have been an ally if he'd chosen. Lister made surgeons feel like they were partners. He made them feel like they were champions alongside them as he was discovering this new innovation in medicine. So that is the tale of two doctors. And at this time, does anybody have any insights or thoughts about what this tells you about a good story or about a good storyteller? I don't know if you want to put it in the comments or.
Yeah, giving people folks to get things in the audience. I see someone has already tagged in being empathetic to your audience. Empathy has come up a couple of times. Having some humility with your communication there. And then keeping things timely and relevant to what's going on right now. Knowing your audience, people have said, is really important, and using really plain language to help explain things. Let's see. I know there's a lot of other good comments in here, but those are some of the key ones.
And that A+, everybody gets an A+. What a incredibly great group of people. Yeah, I mean, empathy and timeliness are going to be a huge theme for the next half an hour. But the thing is, I want to highlight one thing about empathy before we move on, because I can talk about it later, but I want to talk about it now. Empathy doesn't necessarily mean being like feeling what your audience feels. In the case of Lister, he kind of had a cheat because he was a surgeon who was trying to solve his own problems. So I noticed this with clients who are with my clients, like founders who are the same as the clients they're trying to sell to. It's way easier to tell the story. So he could sort of speak empathetically because he was going through the experience. If you're not that, empathy has to be the understanding of why people choose to make the choices they do, why people choose to behave the way they do, and to understand how those choices are driven by emotions and by feelings. That kind of thinking, empathetic thinking, is really, really an important tactic in any kind of storytelling, but especially when it comes to health. So that's an idea that I think is important to emphasize. But yeah, if we anatomize Lister's tactics, a lot of you hit it on the head. Firstly, actually, the first thing I would say is build receptivity. So, empathizing with your audience means you have to find an audience you can empathize with. Sometimes in health, if you, just as Lister, identified like, okay, the Brits here are not going to take me seriously. He didn't try to like butt up against them. He just found a different audience. If I, for example, am trying to get teenagers to stop smoking, let's say it's like 1990 and there's way more kids that are smoking, I probably am not inclined to go towards like, I don't know, my stoner artsy friends in the back smoking. I might go to the athlete who also smokes because that athlete is interested in physical health. And so they might be more receptive to trying out something new. Like, hey, if you don't smoke for a month, see how well it treats your performance as an athlete. Like finding the audience who's open to a behavioral shift is better than trying to convince an audience that is really like resistant. In marketing as well, I'll have clients who have an incredible health innovation and they think they're going to sell it to one market, but as they try out their sales and marketing, they actually realize that there's a much more receptive market that they should go after first. And when those people adopt the innovation, the original market is more likely to do it. So being receptive, finding that receptive audience, and then building receptivity by by telling your story in a sequential way is a really good idea. Speaking simply and clearly, Carl Sagan, Richard Feynman, these are geniuses who are really great at being able to explain the universe sometimes to, school children. It didn't undermine their authority. In fact, I think it amplified that. So I think the smartest people I've ever met are also really good at deciphering how to tell their story in a simple way for more people to understand. Being opaque, being exclusionary is actually a deterrent and undermines trust in your audience. And I've already kind of alluded to this, but breadcrumbing your ideas, not trying to inundate people with a full concept all at once. That's a really, really great tactic. And in the digital age, it actually is even more important. So from communication strategy, if you're looking at social media, if you're looking at your digital presence, figuring out how to breadcrumb those ideas, creating these maps to tell your story in different ways and in different places is very important. Being persistent and adapting. I think this is hard, especially if you're working in public health, because you probably have a limited amount of time and a limited budget when it comes to your communication plans and your marketing plans. So I think that for people on this call, it might be wise to like budget your time in a way where you can anticipate that there might be some pushback or that your first initiative might not be 100% perfect, and kind of like make a plan where you can be adaptive, where you can try something out, kind of run a little bit of an experiment, adapt in your communications. Like mapping that out and not putting all your eggs in one basket is a really good idea, because especially when it comes to changing health behavior, people need to hear the story many, many times in many different ways, often before they decide it's a good idea for them to make a change. And then, as everybody, our A+ students pointed out, articulating their struggle, your audience's struggle, is a really, really important thing. Showing that you understand where they're coming from, how they're feeling. This doesn't need to be explicit, it can be implicit within the storytelling, but that is always going to get engagement. And at the end of the day, especially when we're trying to change health behavior, you will very rarely, if ever, win people over by proving them wrong. Like it doesn't really work. And also, quite frankly, it's not fun. Like I don't think it's fun to put people in their place or prove them wrong. Um, I think it's way better to win people over by trying to make them the hero of change, trying to inspire them to make better decisions when it comes to their health and sort of being their champion, but letting them be the hero of their own story. Because we think of ourselves within the context of a story, and within the context of a story, we are the hero. And this comes to down to like what is referred to as the hero framework. It's a little bit, it pulls from uh, the hero's journey. But if you look at storytelling just in general, you're always going to have a hero in a story that is going to need to solve a problem. And for people in public health and any kind of communication, your audience is always the hero. Your audience is Luke Skywalker. And you, as the storyteller, or as the person that's trying to provide these people with good health guidance, you are Yoda. You are the person that is going to listen to their problem, articulate that you understand their problem, and then give them the tools, the guidance, and the help that they need to solve their own problem and defeat the villain. So, in any kind of framing of the storytelling that you do, this is how you need to think about yourself as the storyteller. Lister did this quite well, right? Lister made other surgeons the hero, right? He's like, I understand how hard it is when you perform great surgery, but people die of fever. Here's a solution that I'm going to give you. Okay, you, the doctor, try this carbolic acid, try this new methodology. And so the hero tries it out. And what do they get to do with that new innovation? They defeat the villain, which is, in this case, infection. So Lister wasn't saying, do what I do, follow me. He's saying, here's what I suggest you can do to help yourself. And that positioning that he seemed to understand instinctively, a lot of great storytellers understand this instinctively, was why, people started picking up what he was putting down. The hero framework, sometimes it's a little bit difficult to figure out what your audience wants or how to write your story in a way where you're positioning your audience as the hero. It's not necessarily instinctive for all of us. So I always try to think about this. This is what I do with my clients. I very rarely ask my clients on our first meeting what their product is or what their innovation is. I want to find out who their desired audience is. And so I ask them, and this is what you can do too about whomever you're trying to communicate with. Okay, what does my audience want? What's getting in the way of what they want? And how does that make them feel? So in the case of Lister, what do surgeons want? They want to save lives. What's getting in the way of it, what they want? That fever that keeps killing off their patients. How does that make them feel? Helpless, incompetent, embarrassed, frustrated, angry, sad. Those emotions get infused in how he told the story. How do you help them? How did Lister help them? He gave them a solution. He gave them an innovation. What's their win? More alive patients. What's their failure? Which is what happens if they don't use this innovation? More patients die. What's your hero's transformation? Well, from a struggling surgeon to a scientifically motivated man of medicine that saves lives. So for people using this framework, when you start to tell your story from the perspective of the audience, crafting that messaging becomes so much easier. Now, I debated as to whether or not we should talk about this in the Q&A or now, but I think that for a lot of people in public health, one of your challenges is that you're not actually trying to get people to do something. You're trying to get people to stop doing something. And the hero framework works for that as well, meaning that if you're looking at people who are conducting themselves or doing things that are harming their health, you can try to figure out their mindset or try to anatomize the story they're currently telling that would explain why they're behaving the way they do. So if I'm thinking about smoking, for example, well, what does a kid that starts smoking want? It's not cancer. It's they want to look cool. They want to be part of a certain group. They don't want to be a follower. Like there's all sorts of things that the story of smoking gives this person and what's getting in the way of what they want. So now you have to start thinking, well, what would motivate somebody? Why are they choosing smoking versus something else? Well, what's getting in the way of what they want? Maybe they're shy. Maybe they don't like sports or whatever it is. Like maybe they, there's all sorts of different ways you can be thinking about like what's getting in the way of what they want. How does smoking make them feel? It makes them feel connected to other people who smoke. It makes them feel like they're in a community. It makes them feel cool. You can start reverse engineering the narrative that they're telling themselves through the hero framework. And when you have that as a model, you can actually try to shift the narrative. Like it helps you then create a new narrative that might land with that particular audience. But by thinking about your audience within the hero framework, you intrinsically think about them from a guide's point of view and from an empathetic point of view. And at the end of the day, I think it's really important to remember that when it comes to a lot of health initiatives and behaviors related to health, people do things because they want to belong, they want to be seen or feel seen, and they want to matter. And when you start to think about the kinds of projects you're working on to inspire healthy habits, healthy behaviors, um, think about what those people want, how they can be seen, and how you can show them that they matter when you are telling them a story about your health initiative. Um, Telling them the facts is not going to move the needle when it comes to changing behavior. So think about it in that way, tell your story in that way, and you probably have a much better chance of winning. So those are the general ideas of good storytelling. I think that at this stage, I'd really love to hear questions and comments, and we can have a little bit of a free-form discussion.
All right, I think we already have one question. I invite y'all to keep putting them in the chat or in the Q&A. The first question that's popped up here is, in what ways can storytelling enhance knowledge exchange between researchers and your practitioners, policymakers, and the public, particularly in this, health communication context we're talking about?
Um, well, I think that when people start talking about their experience, like if you are communicating between different stakeholders in the health sphere, um, instead of couching it in like, oh well, we discovered this or we found this, it's really useful to talk about things within like a scenario. So it could be something like, oh my God, I'm trying to think of something that would work. What were they saying within the context between the different stakeholders?
Just of health communication, using health communication as the context, or maybe an example, if you know.
Okay, so like if I am, I think it's better to like show and tell and to describe a scenario in any way, shape, or form to communicate a new idea. So if I'm talking to, let's say you have two people who are running different health initiatives. I'm trying to think of like an example of we have a client that does that is trying to get people to do blood donations here. And they were telling this really funny story about how they posted um, this they posted a picture of a vampire on Halloween and they had like give blood. And what ended up happening was they had so much feedback on that. Like people were laughing at it so much. They didn't really think that they should do it. There was a lot of pushback from internal on making this ad. And then what ended up happening was the opposite of what they thought, which was like they thought people would get scared and grossed out. Instead, it was so gross and funny that people started sharing it as a meme. And then all of a sudden, they got all of these new donors. So they were sharing that story with us. They were sharing that story with somebody else who they weren't it wasn't a blood drive, but it was another kind of initiative. And what the story told was just, oh, humor, being a little bit cheeky, particularly within the demographic, like they were in the same city. Just sharing the experience with like, yeah, the head of the organization wasn't too keen on it. And now we basically post the same vampire every Halloween and it ramps up our blood donations all the time. So it was like they're not telling the other person what they do, they're just sharing their experience. And also, it's a funny story, right? And then it's also like you can see the ad and it becomes a joke. So I think just sharing experiences within the context of the story and I think that that's where networking amongst health communicators is really important. I have a network of other brand agencies that I talk to all the time. We theoretically would be in competition with each other, but the truth of the matter is, like, we have the same problems, we have the same struggles. There's way too many clients for all of us to serve. So when we kibitz and we share anecdotes about different projects, different clients. We learn a lot by just that. And I think that I don't think people value that kind of just um, sitting around and chewing the fat when it comes to building community and building communication. I think that those are really important things to sort of almost incorporate in your own business model. Where can we get opportunities to network and have casual conversations with each other about our challenges?
Thanks, Kelly. And I'm seeing a couple of people in the chat have brought up the idea of the breadcrumb and what that really means
Okay.
and how you do that. And I think people would love to hear maybe an example if you can kind of
Yeah.
walk them through what that breadcrumb looks like.
Okay. This webinar is a breadcrumb. So I can tell you right now, like I wrote a paper on Semmelweis and Lister, like I don't want to talk about how old I am, but like a long, long time ago. Then I took that breadcrumb and when I started to look at more healthcare innovators, I turned it into, I think, a blog at some point. Then I took that and I turned it into a 2.5 minute video for LinkedIn. Then I took it again and I've turned it into a webinar where I'm talking directly to 200 people. So the story doesn't change, but the way that I've, built it out or the way that I've turned it into something small, I have one story that I'm telling in different places. It's the same idea over and over again, but I'm placing it in different places. So in some ways, marketers might call it like a customer value journey or a marketing strategy where you have these different stories that you are going to tell and you think about when you're going to tell them and then where you're going to tell it. So the medium is going to determine how I create the message or tell the story. And so for a lot of people in terms of in terms of like a health campaign, you may have the same story, like I just described it, in different forms on different platforms. You may also have a campaign where you might do a serial where you're going to pitch like the beginning of your story 1 week, and then the next part of your story the following week. Like you build out a strategy for your storytelling. You're not just dumping it all in one place at one time. And I mean, I'm using a digital explanation of breadcrumbing, but I think also, I mean, we've worked with a lot of people where you might have um, a digital space for that, and then you also have your in real life space for that. In marketing and brand, that actually becomes pretty critical because I have clients where they say, well, we meet prospects at a conference in real life. We've had a conversation. We tell them a little bit about our health innovation. And these people are trying to get big companies to change their health, to change their behavior with technology. Well, what I would do is say, okay, well, you've had a really great conversation and connection with that person in real life. That person in real life is now going back to their house. They want to look you up. So what is the story that you're going to tell on your website? It's not going to be the exact same story that they heard in real life, but it will echo and complement what they heard. And there might be more details on there. And then if they go to the website, what do you want them to do next? It's almost like this, you're planning out their your own adventure. So when I say about breadcrumbing the story, I mean, Lister had the advantage of living in the 19th century when he wasn't inundated with communication the way we are. So he was using the Lancet and creating this serial. For people in public health, it's a real challenge. But I think that if you have one big idea, think of where different chapters of that idea live and where they would best be communicated. And you can almost like map it out. Sometimes we use Post-its and just have the parts of the story and then map out where we would tell it. The medium is just as important as the message, and to paraphrase Marshall McLuhan. And so breadcrumbing your story is really important. Inundating people with too much information is usually overcomplicates things, overwhelms people, and they tend to shut off.
Thanks, Kelly. And I think related to this, several people have kind of commented on this. I'm going to try to make it live, but I'll still read a question out loud for you. But the idea that, especially when you're working with doctors or scientists or subject matter experts, when you try to use plain language, they think you're dumbing down their science or you're dumbing down their brilliant idea or you're making it too simple and you're missing all these great details that are super important to talk
Mhm.
about. So lots of people were asking for some advice on how do you handle trying that balance where we know we maybe need to use plain language with our audience, but the experts, quote unquote, maybe just don't like when their ideas are communicated in a really plain language way.
So I just want to make this clear because I feel like I don't want to impose my own story and my own experience, but like in other words, these health communicators have subject matter experts, and then those communicators are trying to translate subject matter expert topics to an audience. And the subject matter experts are going, you're undermining my, okay. Yes. This is what I often call doctoring a brand. So I have clients who do this too. They're science founders or they're MD founders, and I will show them whatever I've written, and then they come back with comments that are, there's more comments than there is copy. And that's when I have to say to them, you're doctoring your brand. Here's my working theory on that psychology, just so you know. Doctors and scientists have achieved their success by showing what they know, whether it be on tests, examinations, through their research papers and whatnot. Their status and their own narrative, their own identity, getting back with what Margaret Atwood was talking about, is based on a process where showing what you know, their own features and functionality is the source of their success. And so they apply that mindset to all forms of communication. And for health communicators, this becomes a huge challenge because you're almost challenging their own sense of self when you say, no, 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 this simple language will land with the audience better. And so there's this constant fight with that. So my tactic when I'm dealing with a client that is doctoring their brand, is often to just go back to, like, I create an ICP, an ideal customer profile, to go back to the audience and to say, it doesn't matter, like, you to kind of put it on them. Do you think that if your end audience is, let's say, a high school educated, very busy parent, okay? Ask that subject matter expert, do you think that that high school educated, very busy parent is going to understand this word, or understand this part narrative or this narrative? What do you think? Kind of put it on them to justify why we need to have this really opaque scientific language, because the goal is to get people to change their behavior. You can also caveat and say, listen, in this section or in this breadcrumb that we're going to use this simple language. We're going to use this kind of model. But, buddy, your awesome, very fancy peer-reviewed science thing is going to live in this breadcrumb. So you can kind of placate them and say, if people want to get deeper into the science, they can. It's here in a case study. It's here in a white paper, whatever it is. Like, you can say, great, that goes here, not here. So that those are two tactics that I often use when I'm working with those types of people. Sometimes it doesn't work. You are dealing with egos as more than you are dealing with rationale, just as Semmelweis's ego got in the way of his success. So you kind of have to manage that. I've used the heroes framework to reverse engineer the psychology of science founders and doctors. And then sometimes that informs how I can communicate to them.
Yeah, as you could see in the chat, a lot of interest in this idea of breaking it down on how you would explain it to a family member, of kind of putting it on them. A lot of really good
Yeah.
techniques people appreciate. And I know we are close to running out of time. There are other questions that haven't been answered, but maybe Kelly, we can try to connect with you in the follow-up email that we'll send out, try to address a couple of these other questions that we don't have time for.
Absolutely. I love this. I could talk all day about this stuff.
Yeah, and so we'll make sure we share that out with you and then share it out with everyone who's listening today in case your questions. So please drop in questions that haven't been answered yet. We'll do a little bit of wrap up, but then we will circle back with you. So I'll share a couple of closing thoughts. First of all, thank you, Kelly. Thank you, Kelly, and Brave Tale in general for being here today. As you can see, a lot of enthusiasm and interest in how do you tell stories? How do you tell stories in a way that's engaging? How do you please both who you know, your scientific stakeholders and your actual audience that you're trying to get to change a behavior? Stop doing something, start doing something, either way. I think some really good tactical pieces in this breadcrumb. I have a feeling lots of people are going to be thinking about how they can leave breadcrumbs in their own campaigns, in their own work. And so huge thank you to you for being here. And if this is the kind of thing that you're interested in, I'd invite everyone on the call today to look into more activities for the Society for Health Communication. We have an amazing newsletter we put out every month. We've got this brand spanking new website that we're still really proud of that you can go on. You'll see a recap of this webinar. You'll see a preview of webinars to come. You'll see all of our latest news there. And you'll also start seeing very soon here promotions for our annual conference that will be happening, our annual summit that'll be happening here in June. This is from last year, really amazing topics. We'll be releasing the topics and the dates here shortly, so be on the lookout for that. We'll have virtual and in-person attendance, so be sure to be on the lookout. And of course, highlighting our partnership with the Journal for Health Communication, a new issue will be coming out that we partnered with and reviewed, and have some great articles coming soon. So look there on the website to learn more. And the best way to stay up to date, join the society. It is free for individuals, so all of you here can join for free. You can also follow us on LinkedIn. Please do reach out to us if you have questions. And if you are interested in getting even more involved, we also have opportunities for you to join at an organizational level, meaning you and your organizational leadership can be at the table when we're discussing what webinar should we host? What are these big learning opportunities people want to hear about? What topics should we talk about at our annual summit? So that's something you or maybe your organization are interested in. Reach out to that info at Society for Health Com email. We love to tell you more and get involved. And before we jump, I think we're right at time. Huge thank you again to Kelly. That was such a great webinar. Can't wait to share out these slides with everyone. And hopefully we will see you all at our next webinar. Thank you, Kelly. Thanks, everyone.
Thank you very much. This was a pleasure.